RVG System. Introduction to the RVG Sensor, recorded class. By the end of this class, you should be able to define direct digital radiography, understand and identify the RVG sensors, and prepare the sensors for use. Defining direct digital radiography. The RVG sensor is a direct digital radiography system, or DR. DR technology allows for instant image acquisition to the computer. Because the sensor is replacing dental film, you no longer need a darkroom or a film processor. The digital image from the sensor is transferred directly to the imaging software program, where it can be saved, viewed, edited, and manipulated. Because the image is processed automatically, it is displayed in the software instantly, so you no longer have to wait for film development. With the RVG sensor, simply position, expose, and view your images. History of the RVG. Carestream Dental has over 30 years of innovation history in developing and manufacturing digital sensors. From inventing the world's first digital intraoral sensor in 1982 to the first portable digital radiography system, as well as providing the first digital sensor to equal or exceed the performance of film X-rays. Carestream continues to provide innovative solutions based on the foundation of diagnostic excellence, humanized technology, and workflow enhancements. Understanding and identifying the RVG sensor. RVG sensors are built with durability and image quality in mind. The hermetically sealed sensor housing makes the sensor completely waterproof, allowing for more versatile disinfection methods. The shock protective layer helps prevent damage from bites and drops. The combination of high-sensitivity scintillator, fiber optic plate, and high-resolution CMOS provides the well-known RVG image quality and resolution. Patients come in different sizes, and so do RVG sensors. RVG sensors are available in 3 sizes, 0, 1, and 2. All of the sensors have rounded corners for patient comfort. Size 0 was designed for pediatric examinations. Size 1 serves as a general-purpose sensor and is perfect for vertical images. Size 2 is used primarily for the acquisition of bite wing images and periapicals. RVG sensors are radiosensitive. They have an active side and a non-reactive side. Only the active surface of the sensor accepts X-ray exposure for image acquisition. The active surface of the sensor is the flat surface marked with a number 1 or number 2 to indicate the size. The non-reactive surface, or back of the sensor, is where the cable attachment is located. If the sensor is positioned incorrectly in the mouth, such that the back of the sensor, non-reactive surface, is exposed to the X-rays, no image will appear on the screen. RVG sensors have a direct-to-USB cable. The USB cable is 2.0 standard, but can also be used with the USB 3.0 ports found on newer computers. It is important to use the USB ports on the back of the PC tower or a powered USB hub in conjunction with the RVG sensors to ensure signal data transfer quality. Do not plug the RVG sensor or the USB hub into a USB port on the monitor or the USB ports on the front of the PC tower. The RVG sensor is compatible with all X-ray generators that meet the current standards of intraoral radiology. We recommend a high-frequency X-ray generator so that the patient is exposed to a lower dose of radiation. The X-ray generator must operate with a voltage of 60 to 70 kV. The RVG sensor is not compatible with generators that have a voltage less than 60 kV. The user guide provides a table of suggested exposure times for an X-ray generator output of 70 kV and 7 mA. These are suggested exposure times only, as exposure times vary by type and age of the generator. As a general rule, if the images appear too dark, reduce the exposure time. If the images appear grainy, increase the exposure time. Carestream Dental is committed to continuous improvement of its products. To assure that you benefit from all product and software updates or upgrades, we recommend that you perform the following. Contact your supplier at least once a year and ask for available updates or upgrades. Sign up for a maintenance contract with your supplier. And register your product online at http://register.carestreamdental.com/EAMER to receive update information. Preparing the sensors for use. You must cover the sensor with a barrier prior to use. Apply the barrier before you place the sensor into a positioning device. If you need to change positioners during use, you do not have to reapply a barrier. To begin, select the appropriate barrier. Using a barrier that is too small could cause tears, which can contaminate the sensor. Using a barrier that is too large can cause discomfort to the patient and can trigger a gag reflex upon placement. Quick tip: using a finger cot on top of the barrier can help prevent tears during the X-ray exam. After you select the barrier, slide the sensor into the barrier. Make sure that the barrier slides all the way down on the sensor. If necessary, use your thumbs and forefingers to push the sensor to the end of the barrier. You should now be able to define direct digital radiography, identify the RVG sensors, and prepare the sensors for use.